IC self-help strategy number 4, dietary supplements. Now, here's a hard reality about IC, and that is we only have one oral medication approved for IC by the US FDA. It's known as Elmeron. The generic name is called pentosan polysulfate. But unfortunately, it is associated with some pretty severe adverse events, notably retinal damage. It's called pigmentary maculopathy. And now we have a new adverse event, inflammatory bowel disease, which has required some patients to have colectomies, having to have portions of their bowel removed. So, and, gosh forbid you don't have health insurance. If you don't have health insurance or you could not afford Elmeron or other medications, what were your options? Well, thankfully, we have a nice variety of dietary supplements that thousands of patients have used quite successfully. And interestingly, it's the American Urology Association that is encouraging you to try them because they don't carry the same risk of adverse events that more traditional medications carry, like Elmeron with retinal disease. So there are kind of 4 different types of supplements that are out there. One of the most popular supplements is called Prelief. It's an acid reducer. You can see it on the wall behind me. See that right there? So Prelief is a very simple calcium pill that will reduce the acid of any food you're eating. So if, for example, the holidays are here and you've got to go to grandma's house and you got to eat her lasagna and you're terrified of the flare that tomato sauce can cause, 2 caplets of Prelief could dramatically reduce the acid load and make that food a little bit more enjoyable. So Prelief, that concept of an acid reducer, is very, very popular in the IC world. The second thing that we want to think about is something that will have a bit of a coating effect. And these are supplements that contain chondroitin. Chondroitin is a building block of the bladder wall. Chondroitin is essential to the superficial integrity of the bladder wall. And so many patients have found success with some chondroitin-based supplements. Again, this is really for people, I think the best scenario is with estrogen atrophy, a thin bladder wall, or an irritated bladder wall, because they potentially could add a little bit of extra protection. Now, none of these supplements can make any claims about being a treatment of IC. The FDA does not allow that, but they are really more for bladder health, and that's what you're going to see. So the most popular chondroitin-based supplements are going to be Cystomend, Bladder Rest, and Bladder Builder. And you can learn a lot more about these and the different things that they do on our website. Another type of supplement is a supplement that has a soothing effect, aloe. So, if you have a sunburn, what's one of the things you can do with a sunburn is you can put some fresh aloe on it, and it's remarkably soothing. Well, aloe has also been found to be soothing in the bladder. And so aloe supplements are quite popular, especially if you're flaring. And so the aloe supplement that we support is called AloePath. And the reason why is because it doesn't just have aloe in it, it has another ingredient called PEA, or palmitoylethanolamide, which has been proven to calm nerves down. So you get the soothing effect of the aloe with the nerve calming effect of the PEA. And speaking of PEA, this 4th type of supplement is a supplement that has the potential of reducing some pain and discomfort, but they're not pain medication. And this, in fact, is Peora, or PEA. Now, the active ingredient in PEA is palmitoylethanolamide. So palmitoylethanolamide has been studied for decades in Europe for acute pain, chronic pain, fibromyalgia, burning mouth syndrome, you name it, they've studied it, surgical pain. And the results have been incredibly encouraging. Very, very few side effects and remarkably effective, and yet without the dangers of an opiate, of overdosing and just dealing with the burden of just trying to get traditional pain meds. There are many patients who cannot get traditional pain meds. Okay, so in 2019, European researchers brought to the United States, to the annual American Urology Association meeting, a new study they did with PEA and interstitial cystitis. And the data was stunningly good. The 87% of IC patients who tried PEA reported a significant reduction in their pain by month 3. And so this is kind of the new generation. We kind of have the old generation of supplements. Now we have the new generation of supplements. And the general consensus about PEA is it acts by calming nerves down. So a lot of patients ask me, what do I do? Well, I have a healthy bladder, so I don't need to do chondroitin, but I have an extremely sensitive nervous system. And so because I'm very, very invested in wanting to keep my nerves as calm as I can, I will use this PEA off and on. And I found it to be remarkably helpful just in calming my skin down, right? Because sometimes my skin gets super, super prickly. But of course, what works for me would not work for you and vice versa, because ultimately it depends upon what your unique subtype is. But just know that we have a lot of options now for you to explore. And you can come read a lot more about these supplements over on the IC Network website. I'd be happy. We have some good supplement guides, kind of the protocol based upon estrogen atrophy as compared to pelvic floor, et cetera, et cetera. So anyway, you can find a lot more information about some of these supplements right over on the IC Network website and in our shop.